The Biden-Harris administration, through the U.S. Department of Health and Human Services, a blue colorized photo of adults sitting in a therapy session as the title of the video appears, is pleased to announce the release of the 2024 National Strategy for Suicide Prevention and the first ever federal action plan. Suicide is an urgent and growing public health crisis. Purple, blue, and cyan silhouetted people of different genders, races, and ages appear on screen. Every year, millions of people think about, plan, or attempt suicide. A map of the U.S. transitions into a line of people icons as statistics are shown. More than 49,000 people in the United States died by suicide in 2022. That's one death every 11 minutes. The title overview appears over two booklets, the National Strategy for Suicide Prevention and the Federal Action Plan. The National Strategy and the Federal Action Plan offer a renewed focus and comprehensive, whole-of-society approach to suicide prevention. The National Strategy booklet pages fan out as a graph appears showing suicide rates from 2000 to 2022. The 2024 National Strategy will guide our approach to suicide prevention over the next decade. Suicide statistics begin to float over a backdrop of the fanned-out National Strategy booklet pages, and is a direct response to the changing landscape and trends in suicide and suicide prevention. Dots forming a map of the United States appear on screen and breaks down into different communities. This coordinated and comprehensive approach to suicide prevention at the national, state, tribal, local, and territorial levels relies upon critical partnerships across the public and private sectors. The map dissolves into a video of medical professionals working. Goals of the National Strategy begin scrolling across the video of the medical professionals working. People with lived experience are critical to the success of this work. A photo of a training session appears with an instructor at a whiteboard. We call upon all our partners to join us in taking action to prioritize suicide prevention efforts across our country. The title Call to Action appears on screen as a video of people placing their hands on top of each other dissolves in. Our call to action is urgent. It's more than just words. The words care, connect, collaborate appear one at a time animated over the video. It's a commitment to care, connect, collaborate. The word care is highlighted over photos of people getting mental health help. Care. Caring about suicide prevention requires a thoughtful strategy and the intersection of prevention, intervention, and postvention supports. Connect is highlighted over photos and video of people together. Connect. Connecting to community and culture are key protective factors for health and well-being, including protecting against suicide risk. Collaborate is highlighted over photos of people participating in training sessions. And collaborate. A comprehensive approach relies on collaboration with public and private sector partners, people with suicide-centered lived experience, and people in populations disproportionately affected by suicide and suicide attempts. The title Urgent Need appears on screen over video of a therapy session and photos of concerned people. There is both an urgent need and unique opportunity to make significant and measurable progress around suicide prevention in the United States. Now is the time to act decisively to eliminate suicide risks and promote healthy and more resilient communities across the United States. The title Collaborative Effort appears on screen. The title then fades out to have the logos for the Department of Health and Human Services and the Action Alliance on top of dots creating a map of the United States. Given the urgency, the Substance Abuse and Mental Health Services Administration, Centers for Disease Control and Prevention, along with the National Action Alliance for Suicide Prevention, led the development of these critical deliverables. The U.S. map fades on screen as a split photo of smiling people talking appears, followed by a video of a counselor speaking to a client. Working together as partners alongside states and communities and people with lived experience and those most impacted, we can address the many factors increasing suicide risk and promote well-being. The National Strategy seeks to prevent suicide risk in the first place. A purple booklet, the National Strategy for Suicide Prevention, moves on screen from the bottom corner. To the right of the booklet, a series of photos and videos are shown, including a photo of a suicide prevention training whiteboard, video of teenagers texting, video of a counseling session, and a photo of a couple comforting each other. It incorporates advances in the field and addresses emerging issues like social media and equity. It focuses on addressing the many risks and protective factors associated with suicide, with the recognition that there's no single solution to this complex challenge. A blue booklet, the Federal Action Plan, moves onto the screen from the bottom and reveals an oversized page from the plan in the background. In the Federal Action Plan, over 20 federal agencies have identified more than 200 actions to be taken over the next 3 years in support of those goals. Tens of dots appear on screen with the word action in them. 3 are singled out. One by one, the camera zooms in to the singled out dots containing actions. In 2024 alone, agencies have committed to things like expanding suicide risk screening across Indian country, improving 988 data collection, and developing resources to help communities implement strategies to reduce suicide risk in the first place. The blue-tinted photo of the therapy session from the beginning appears and dissolves into another group session of adults. There's power in our collective action. Together, we must act to prevent suicide and to promote healthy and resilient communities across the United States. The words care, connect, collaborate appear on screen over a blue and purple field with a spiral design in the center. There is a QR code linking to the strategy on the internet. Join in these efforts to care, connect, collaborate. The phrase "hope is possible" appears over the same background. Everyone has a role to play in preventing suicide. Hope is possible. The words disappear in the background as the spiral gets bigger and the screen fades to white.